My name is Janiyah Anderson, and today I just want to talk to you guys a little bit about how I feel on arthroscopic procedures and the errors that have become so frequently with them. Frequent errors in arthroscopic procedures can vary, So I want to get into why these are happening and what can we do as sterile processors and working in the sterile processing department. What can we do as a team and individually to stop these errors from happening? So based on my experience in the medical field, I'm aware that clinical failures can happen often. Many issues can vary in this subject, and a few of them are listed here. So a thorough inspection of instruments could have possibly failed. And that is one of the reasons why many errors can happen in arthroscopic procedures. Quality of instruments can be one of the many problems. Sometimes, a lot of times actually, sterile processors underlook or overlook an instrument, and it becomes unnoticed that the instrument is not qualified to work with a surgeon. That's why it's important for us to open and close instruments, make sure that they are functioning properly, because that is our job, and it starts in the sterile processing field, in the department. So once the instruments are there and they go on for use, at that point, the items are still in our care because we sent them out to the floor. So that could possibly be one of the many reasons of errors happening. It is possible for instruments to be underlooked a lot of times. And a lot of technicians forget that some soil cannot be seen with the naked eye. And that's why it's so important that they initiate this to us. It is important that we remember that just because we manually are cleaning an instrument, or just because we can visually see with our naked eye that this instrument is not dirty or it does not have soil or any type of leftover debris on it, but it could potentially be more soiled than what we think or than what we can see. So the importance of being sure that sterile processors and those working in that department, the whole main goal is to make sure that instruments that we are putting out on the floor have the quality and are properly cleaned and sterilized so that they could be sent to the floor, so that they don't create errors. And this is just one of the common sense things. I mean, you would think that a sterile processor, with the experience that they have, they would know these things. Go to work every day, all of these hours, we should know these things. But I am aware that errors happen and things can happen. And so, yeah. Another possible error that could possibly be is lack of experience, and which I just talked about in a different way. I've worked in the healthcare field for about 4.5 years now, and I've seen many cases where the management has hired workers with license but no experience, and the other way around. Well-rounded of experience but no license. And I happen to be one of those people. It's been either way it goes. It goes there. There's been a lot of cases where employees or new hires don't even have the knowledge of the basic description of their job or assignment. So yeah, as I said, I've been working in this healthcare field for many years, and there's been multiple times where I've helped those higher than me. I'm a CNA. I've helped LVNs and RNs and even wound care nurses with some of the jobs and duties that they had. And this is just because based off of my experience and the knowledge that I have. I've been there and in the healthcare facility, so I know I have a good amount of knowledge of what things to do and what not to do when it comes to the patient. So I feel like that is honestly one of the very big problems. So as far as solution goes, I honestly advise that facilities should try new experiments. One that gives knowledge to the employers of that department, honestly all departments. And when I say solutions, I mean like different skills and different tests. So let's say maybe scheduled surveys based on the work process of surgeons or employers in the sterile processing department, and also their work effectiveness. Build line graphs, save and record data on how the sterile processing tech or surgeon is working so that professional criticism can be given. I feel like when we create safe spaces like this for the team, it could help promote the team to grow individually. Everyone should want to work for themselves, especially after being in a team and seeing the potential in yourself individually and what we can do as a team. So if we have, some workshops out there that will potentially help us, then that'll be great. And like I said, professional criticism can be given. I mean, that's what we want. We want professional criticism. We want others to tell us where we are lacking in and where we need improvement in, especially working in a professional field, so that we know what we're doing right. Although we know, but it's always good to have a professional view of how you're doing. So, yeah. Maybe even trying workshops, as I said, seasonally within the origin, so that way not only experience can be built, but visual and physical knowledge within one's career in the sterile processing department. So as I told you guys, I did a well amount round of research, and my research actually says that, based upon an article that I read by Corporate Class Inc., workshops can create a sense of empowerment, which can lead to increased motivation and productivity. By following this practice, the team skills can expand to a greater outcome. I mean, if we are taking the time out to practice these things, as a team, then maybe as a team, we could improve. Maybe even some required monthly examinations by the state, almost similar to having to take a test to keep one's license. If the state can come up with a way to do a monthly checkup on sterile processing departments and their work effectiveness, and just seeing where they're building in the areas that they're improving and lacking in, maybe that can potentially help, not just individually but as a team also. Especially if we have like a team-based system, that'd be great. If we could have a team-based system on just how we work together as a team, and just our outcomes and errors and our positives and negatives, our pros and cons, that would be great. And that would maybe potentially build one's career skills individually. In my opinion, honestly, if certain laws were more strict, a lot of errors may not have happened. So one of the main errors in arthroscopic surgeries is a lack of practice. Those were just some of the many solutions I could see following successfully similar. So, and honestly, that's just my experience also. Honestly, guys, if I can potentially see with my own eyes that the arthroscopic procedure field is having errors, then come on, what could it possibly be? Being that they should have all of the practice that they do need, but they don't, and that's okay though. Not everybody has the practice that not everybody is open to the practice that's received to them. So that's okay, but it will, in the long run, it will affect your team. So with the permission given by my mother, I'd like to just share a short story given, if you guys don't mind. So, and like I said, this is just based on my experience. I'd like to share a short story on an event that happened with her regarding arthroscopic procedures. So my mother suffered from a sciatic nerve, or also known as sciatica, located in her back, which is a pain that can go from the neck to the lower leg. This pain travels through the path of the sciatic nerve. So being that the sciatic nerves is one of the severe nerves, of course, she was in a lot of pain. So she got ordered an arthroscopic microdiscectomy for sciatica, a decompression following to that source. Long story short, an error occurred to where my mother had to retrain herself on how to use the restroom. And based on my research, her pudendal nerve was disrupted in between the surgical process. So, in my opinion, this just follows up with my reasoning of lack of practice being one of the many reasons why errors occur. Now, I don't know for sure if that was the reason, but I would assume that what else could it possibly be? I mean, the quality of instruments, that could be one of them, but it has to be lack of practice. You're an arthroscopic surgeon. You've been doing this field for I don't know how long. This isn't your first surgery. You should know what to do. You should know what to look out for. You should know what instruments to use to block certain nerves or to dissect certain things. You should know what to do. So this is why I say lack of practice has got to be one of the biggest reasons. If the team can spend more time practicing their work effectiveness, just maybe, the number of errors will reduce. And I don't even think that's a maybe. I honestly think for sure the numbers will reduce if the team can work effectively and just focus on the main issue. Now, that's just the first part of my questioning on the many things that's going on in arthroscopic procedures. Going into my next question, I want to know, why are infections the most common complication with arthroscopic septic arthritis? And how is this common complication being treated today? Now, we know that any procedure can present a risk of infections. Again, if you've worked in the healthcare field, then you should know you can get an infection from the tiniest things. But if you take care of yourself properly and you follow protocols, then this will not happen. But I feel like this has a lot to do with the errors I stated recently, as far as why surgeons are, as far as the errors in the arthroscopic procedure process. So this just follow-ups right with that, honestly. An infection after an arthroscopic procedure can happen right away, and it should be treated right away. And I got that information from an article as well. And of course, based on the experience that I've had in healthcare. But based on the article that I was reading, Glenn's Solicitors, I was reviewing one of the few possible errors can be wrongfully arthroscopy studies. So wrongfully arthroscopic studies say that this procedure shouldn't be done if not necessary. It's easy for an infection to break out if the surgery isn't beneficiary. So a lot of times surgeons are just calling the surgery and they're not taking the time out to potentially overview if this surgery is necessary or not. And in some cases, that can potentially lead to an infection. Why would I get an open heart surgery if I don't have any issues with my heart? Of course, I would assume that I would get, an infection or something, because I've never had any issues with my heart. So that makes a lot of sense on why some of the errors are happening. Another reason that was listed was delayed treatment and diagnosis, which is also a very big cause in infection, and not even just for arthroscopic procedures, but for a lot of procedures and for a lot of other things also. Excuse me. It's highly important that an infection is detected in a timely manner, and if that is the case, it must be treated right away. A lot of times, I believe that workers in the sterile processing department, or not even just in the sterile processing department, but in the operating room, we kind of take our time. Well, not we, but those workers, they take their time. At the same rate, they're on a time limit. So it could be very stressful for them, being that, they have to take their time so that errors are not made, but also that they are on a time limit. So in that case, I do feel like it's highly important that this is overseen, because if not, this could possibly lead to a death, and a death could possibly lead to, not possibly, a death will lead to everyone in the facility losing their job. We'll all get sued if that happens. In my opinion, if an infection isn't treated right away, this leads to a bigger matter. Like I said, this can be a sign of abuse as well. Surgical conscience is neglected when patients develop infections, if you ask me, because how could this possibly even happen with such seriousness of a surgery? You would think, that an infection would be closely monitored before given the chance to grow and progress. Or not even just that. If you're familiar with an arthroscopic surgery, you should be familiar with infections being very, very common, and you should take precaution when dealing with someone when doing this procedure, so that these infections don't break out, or so that errors don't happen. I did some research on what facilities are doing today to try and fix the issue, and they've come up with a surgical process that could potentially reduce the number of undiagnosed infections. And I honestly feel like the procedures and precautions that they came up with, they can help. And if we follow them correctly, even some of the solutions that I stated, if we can follow these correctly, then it could possibly reduce a whole lot numbers of errors and other complications happening within that field. The surgical procedure initiates the removal of the inflamed tissue. So that's just regarding the arthroscopic procedure. This is how they do it. They remove the inflamed tissue, and the stage of the infection can vary. So knowledge of the infection itself is clearly important. These infections have stages, and you need to have the knowledge on what to treat the patient with if an outbreak like this happens, or if an infection like this happens. Being that arthroscopic surgeries can lead to an infection so fast, this is why I feel like extra precautions should be done for this case, for this reason. After surgery, patients should be treated with antibiotics to prevent the infection from reoccurring. Extra tests should be run. Although I do understand that it isn't easy for one to unknowingly take care of an infection, especially if they don't, like I said, unknowingly after a surgical procedure. That's why I would advise or suggest that extra precautions prior to this procedure is necessary. Not even just prior, but before also. Extra tests should be ran prior to the surgery, even scheduled multiple follow-ups, just to be sure that the infection will not spread and colonize. Maybe if we can get some extra testing done, then we could catch the infection before it has that actual potential to spread or colonize. If we can take the time as a team in the sterile processing department to make infections our number one priority of them not happening, then maybe that could also reduce the number and the errors of what could potentially happen with those surgeries. So it's very hard to move at such pace, and I do understand that is why a lot of errors are happening. As I said, when you're working in a team in the sterile processing departments, they are on a time limit. So especially if you have an assignment within the procedure department, surgeons have places to be, other patients to take care of, jobs at different facilities. Where do I stop? I understand 100%, but when working as a strong team, infections after the arthroscopic surgeries could be lower, much lower than what they are. I feel like a lot of times we forget as a team that just because we are on a time limit, that does not mean not to focus on the main product here. So we could be on a time limit, we could be on a scheduled whatever. We could be on all of that, but with the skills and the knowledge, we should potentially be able to grow and progress from that. So, honestly, guys, just based on what I've listed and the solutions that, I have to arthroscopic surgeries and what we can do as a team to help prevent these things from happening, I honestly believe that as a team, if we can work together effectively and efficiently, it will not only lower the rate of a lot of errors and risks, but at the same time, we will build ourselves individually and as a team. We will build ourselves, we will build our skills, we will build our career life as a team and individually. Communication is one of the biggest problems in the healthcare facility field. So if we can build that trust as a team and stay focused on who's important in surgical situations, in other words, the patient, the work we demonstrate will definitely speak for itself. So all we have to do as a team is make sure that our main goal, which is the patient, is taken care of. Does this patient need this? Does this patient need that? Does this patient have anything we should know about? This is why all those assessments and those requirements are necessary before surgery is being done, because infections can happen, things can happen, you never know. So it's important that we know all of these things and we keep these things well-rounded. And it's also important that we always work as a team and we always use our surgical conscience, so that way possible errors like these cannot happen, or not bound to happen. We work better as a team and we work efficiently and effectively as a team. And I'm pretty sure the patient would rather a team than, rather someone doing it by themselves. So if we can all just build each other and work together and come up with ways on how to speak to each other so that we can grow as a department, then we will be all right. And our patients will be okay also. So that is all I have for you guys. Thank you so much for taking the time out to listen to my podcast. I hope you guys gained a lot of knowledge on the questions that I asked. I know I did within the research process. This was very fun for me. However, I think it's important that we remember to work together as a team and from so on.